Hello, this is Eitan Shalom at the Body Mind Wellness Center, and I want to show you what I'm doing on this patient of mine who is a landscaper and has a lot of stress. So there's both tension and myofascial pain, trigger point pain from both her activity levels and stress levels. And why is the camera blurry? There we go. So first of all, what I wanted to show you is, so she has interesting low back pain that wraps around the side of her back and her ribs. So I've done the dry needling on the paraspinal muscles here. These are paraspinal muscles, these are paraspinal muscles, but this point here is actually needling the psoas muscle from the back. And what you do is you bring your hands down the side of the back until the quadratus lumborum ends, and then you'll feel kind of a ditch there. And then this is the needle here, and I took my gloves off. Normally I'm wearing gloves. And so this is the needle that's into the quadratus lumborum. And and the thing is, when this needle was in, she even described the referral pain down into the attachment of the iliopsoas onto the front leg, which is where she's also describing pain. So that was a very successful point location. And these needles here are in the ligament that crosses over all of the spinous processes of the vertebra. So that's what those are. And then I did that psoas point on that side as well, and a couple of paraspinals. She also has a pain that wraps around from the mid-back, so on the right side. So I've done the paraspinal muscles there and one of those ligament points between the spinous processes of the two vertebrae. And then coming down here, I did some interesting needling of the piriformis, but also the, now I'm forgetting the name of it, the ligament. What is it called? I'm just blanking out because I'm in the middle of three things. Anyway, there's a ligament here, very important, that I needled here. You can see even the skin got red, and that was exactly what she was pointing to. And that's the ligament that opens up, helps to open up the pelvis. And then finally, I've been talking recently about the adductor magnus. And so here we have the adductor magnus, one of the adductor magnus trigger points. And I got a very large release on that one. And when I put this needle in, I didn't get a big release, but then I left it alone for a while and came back. You okay?
Yes.
Yeah, and so that's.
I feel it all the way to the middle of my leg.
Okay, good. That's the pistoning technique that releases the trigger points and stimulates the motor points that I just did there on the adductor magnus. And then we've also done some work on the calf here. That's pretty typical work, and I'm not going to talk about it that much, but just releasing trigger points and stimulating motor points on the calf. But then what's interesting is she had her pain wrapping around the ankle. So I've done some needling into the plantar fascia. Those points needle the plantar fascia. And so that's, as you can see, there's sort of I'm treating, because the fascia in the body starts all the way up in the head and goes all the way down to the foot in one continuous flow of fascia. And then, in the past, I treated a strong left-sided pain, which has improved. So now I'm basically seeing this as a continuum rather than discrete parts. And from even actually from the upper trapezius here and down on the right side, especially the psoas and the spinalis muscles and the piriformis and the quadratus femoris, and then the I can't remember. I feel stupid. I can't remember the name of this ligament. It's just escaping me this second. And then the adductor magnus. And the adductor magnus, because she described pain, see, the adductor magnus can be involved in pain that goes actually into even the rectum or the vagina or anywhere near there. So that's why I knew the adductor magnus might be involved. And then when I needled that, we got a huge release. And then coming down all the way down to the foot, all the way down to the instep. And I'm going to take these needles out now and do a little bit of needling on the front of her body on the tensor fascia lata. Thanks for tuning in.